Knee pain is a rising condition, not only in old age people, but also young generations who are active in sports, doing all kind of different physical activities like hiking, swimming, or any other activities where there is more wear and tear with the knee. Now, why this condition is rising is quite obvious. Either the knee is not taken care of in terms of old age, or in young generation who are doing more physical activities, the knee uses is more and the lubrication in the knee is not nourished properly. Ayurveda has clearly mentioned that those who exercise more should do oiling on the joints very regularly. So this is a guidance for Vyayama. After Vyayama, oiling is must. So especially the athletes or sportsmen who are into a lot of activities where the knee is mostly used, they should always oil it, and which is not done regularly. This Indian practice is almost not implemented even by the athlete coach or the physiotherapist. I think that is the key why more younger generation are going into knee injuries. And not only knee injuries in terms of only pain, but even the cartilage degeneration, the cartilage tear, the meniscus tear, or even the ligament tear are more common because the strength in the ligament and the joint space is not sustained in such sportsmen. Namaste, I am Dr. Abhijit Jinde from Sukhayu Ayurveda, practicing Ayurveda clinical for last 25 plus years. I get a lot of knee condition people from different age group, and today we will talk about what Ayurveda has to talk about knee pain, its causes as per Ayurveda, and the line of treatment or approach for complete and good recovery. Let's segregate or separate the knee pain condition in two categories. One is the old age, which is mostly degenerative, and the other is the young age, which can be because of injuries or wear and tear. In old age degenerative conditions, Ayurveda clearly mentions that the Vata dosha or the air element increases after age 60. So naturally the body is undergoing degenerative changes in every cell of the body and more prominent in the joints because there is Vata naturally increasing. There is more dryness which is created. So the synovial fluid in the knee joint is reduced. The lubrication is reduced more in the old age. Typically what happens after age 50 or 60, because of fear of weight, because of fear of diabetes or heart conditions, a lot of population reduces ghee, milk and lubricating fluid or food items which are actually more necessary in this age. So to mitigate the increased Vata, actually you need to include more oily, greasy things in the food, more healthier ones, and also taking note that you are digesting it well. But if you reduce it completely after age 50, it creates early degeneration. It will create more dryness in the joints. So I think that is the key reason why we see more degenerative knee pains now than much before. If you see, your grandparents were not having that knee pain till the age of 70, 80. But now my parents would have it at the age of 50 because of wrong perception of completely avoiding oil, ghee or lubrication in the food. So that is the important cause in old age degeneration. In younger populations, on the contrary, the degenerative changes happens earlier because of two factors. One is there is injury which is not properly recovered, or there is nutritional deficiencies like calcium deficiency or vitamin D, or lack of proper care in athletes, sportsmen, people who do a lot of exercise, who don't take care of the joints, knee joint, by applying oil or giving good nourishment. Now, almost in 70+% of people with degenerative knee pain or even with non-degenerative knee pain, we find a history of injury in past. So the patient will let us know that he had fallen sometime in past and there is some injury, and that knee goes into the degenerative condition more often. In both this condition, whether it is age-related degeneration or in younger population, the key line of approach should be strengthening of the knee joint space. So one should improve the synovial fluid for the lubrication. One should improve the health of the cushioning cartilage. One should strengthen the ligaments and the adjacent muscles around the knee joint space. In modern medicine, the conventional therapy involves painkillers, calcium, vitamin D for nourishment, which is quite obvious. There are some specific glucosamine category of medicines which are improving the cartilage health, but they are still not very effective. We see a lot of population going into the stage of total knee replacement. I think early identification of vulnerability can prevent knee replacement surgeries. Knee replacement surgeries are a good solution where the person is totally in immobility, but it may not restore the full range of movement which he or she had before the surgery. So it's always wise decision to accept Ayurveda, do the therapies and the dietary guidance by the Ayurveda physician, to not take the condition to the stage of surgery. In Ayurveda specifically, oil massage, which has specific oil formulation to improve the health of knee, is advised. Other therapies involves rice potli, shastik potli to improve the strength of the joint space. Local dhara, another very important therapy in Ayurveda, is Janu Basti, where the oil is pooled on the knee joint space for almost 30 to 40 minutes. We believe that the oil with its quality of herbs definitely gets absorbed through the skin and it nourishes the joint space. The modern medicine has understand the skin as the medium or route for delivery of medicine in last few decades. But Ayurveda knew about oil thousands of years back. It knew that the medicine can be delivered through the skin. And it's quite advanced pharmacology which Ayurveda knew so many years back. One should take advantage of Ayurveda and prevent knee pain, knee degeneration, and can prevent surgeries. Ayurveda is definitely a very promising hope for knee pain. Thank you very much.